Welcome to Cardio Radio, a podcast of the Ohio Cardiovascular and Diabetes Health Collaborative, also known as Cardio. This is Dr. Michael Constant from the Case Western Reserve University School of Medicine, and I serve as the principal investigator for Cardio, a statewide network of Ohio's 7 medical schools. Cardio is funded by the Ohio Department of Medicaid and shares best practices to improve cardiovascular health, diabetes outcomes, and to eliminate health disparities in Ohio's Medicaid population. The opinions and recommendations in this podcast are those of the presenters and not those of Cardio and its sponsors, and are not intended to be a substitute for medical advice. I hope you enjoyed today's podcast.
Hello, I'm Dr. Robert Bales, Assistant Professor of Family Medicine at both Case Western Reserve University and Ohio University's Heritage College of Osteopathic Medicine. I'm a family physician at South Point Hospital and a member of Cardio Team Best Practices. I'm joined today by Dr. Patricia Ryan, an Associate Professor of General Internal Medicine at the Ohio State University School of Medicine, and a Med-Peds primary care physician with research interest in quality preventative care. In this podcast, we'll dive into a discussion about digital technologies for helping patients adopt health-promoting lifestyles and behaviors. Welcome, Dr. Ryan.
Thank you, Dr. Bales. It's great to be with you today.
We know cardiometabolic diseases are the leading causes of morbidity and mortality in the United States, and lifestyle changes are a critical element in prevention. As clinicians, we try many techniques to help our patients make important changes in their lives, yet many do not consistently get the results they and we hope for.
It is a big challenge. Technologies can support clinicians' efforts to guide patients in making lifestyle changes and maintaining healthy behaviors long-term. Digital tools are being rapidly developed and deployed. They may increase patients' motivation, help them track their progress, and provide education and support.
Before we get into the individual technologies, what is the underlying basis that makes them effective?
New tools are in continual development, but some of the strategies and concepts underlying digital interventions include self-monitoring, self-motivation, goal setting, and reminders. And then there's personalized feedback, participant engagement, virtual social connections, psychological empowerment, persuasion, and enhancing self-efficacy.
Can you give us an overview of some of these digital tools?
Sure. They include mobile apps, wearable devices, text messaging and email interventions, social media, web-based interventions, and online educational videos. Some interventions incorporate games, rewards, and challenges to motivate users. They can also provide convenient ways to track food intake and physical activity.
Okay, let's talk about the specific tools. Let's start with some older technologies like text messaging and good old-fashioned email.
Text messages can give timely reminders for things like exercising, taking medications, and attending medical appointments. These messages can prompt specific actions like drinking water, taking a walk, or eating a healthy snack. Text can provide motivational support by sending timely, positive reinforcement statements or sharing success stories. Texting can be used to build social support by connecting patients with peers or support groups which build community. These are all factors which promote adherence. Education can be enhanced through delivery of small chunks of information about nutrition, diet, and exercise. Text can be tailored to an individual's specific needs. Personalized texts are likely to be more engaging and encourage adherence.
Thanks for those examples. But what does the evidence show? How effective are text messaging in producing improvements in health behaviors?
Overall, there is some reasonable evidence that text messaging has efficacy in promoting adherence to some healthy behaviors regarding cardiovascular health. A Cochrane Library systematic review in 2019 that automated text message-based smoking cessation interventions resulted in greater quit rates compared to usual care. The review concluded that short messaging programs may enhance quit rates by up to 50 to 60%, which is really good. However, another systematic review found little or no evidence that text messaging improved medication adherence, blood pressure, LDL cholesterol levels, or fatal and non-fatal cardiovascular events in studies of secondary prevention in cardiovascular disease. Another different Cochrane review found that text messaging improved diabetes care self-efficacy scores. It also found that compared to email prompts, text message prompts to patients with diabetes resulted in more reported glucose results.
What about any other evidence?
We know of at least one meta-analysis study assessing improvements in preventative health behaviors in response to text messaging interventions. In that citation, there were 35 studies, and they had findings of improvements in smoking cessation and increased physical activity, but no change in weight loss. Additionally, there was a review article that found the majority of published text messaging interventions were effective for diabetes self-management, weight loss, physical activity, and smoking cessation. A randomized controlled trial published in the Journal of the American Medical Association in 2023 demonstrated that personalized text message-based smoking cessation interventions were more effective for maintaining biochemically proven abstinence from smoking at 6 months than non-personalized text messages.
So how does text messaging compare with email? Which is more effective?
In reviewing the evidence, text messaging appears to be more effective than email. We can hypothesize multiple reasons for this, including simple things like email filters, patients not always opening their emails. We also know that for many patients, the internet may not be accessible on a consistent basis. Evidence shows that text messages are more likely to be read, often immediately, and phones with texting ability are more ubiquitous.
Let's turn our attention to interventions that are delivered via the internet or online sources. What are some website-based interventions, and what have they been used for?
Websites are readily available to assist patients with several lifestyle measures that impact cardiovascular health. Currently, websites are one of the most frequently used methods of digital health interventions for improving lifestyle, along with use of apps. Most of the studies on website-based interventions focus on sites that support changes to diet and physical activity. I am not intending to single out or endorse any particular sites, but many websites are popular with my patients, and they often have both free, basic versions or expanded pay versions. For instance, MyFitnessPal, Calorie King, and Lose It. Some other sites like Noom and Weight Watchers offer free trial periods. These websites mainly focus on tracking and goal setting as drivers of personal change. There are several good websites for smoking cessation, including quitassist.com, which offers plans, as well as text messaging programs, smartphone apps, and online help. The CDC has a web page with lots of helpful resources for smoking cessation. The Ohio Tobacco Quit Line has web-based materials for tobacco cessation to help with planning to quit and tracking one's progress during quit attempts. There are relatively fewer studies that look at digital interventions for other lifestyle aspects that can contribute to cardiovascular health, like substance abuse, improving stress management, sleep, and social relationships.
Okay, how effective are website-based interventions?
In general, interactive sites seem to have better engagement and better results than purely informative or static sites. For example, one randomized controlled trial found evidence that interactive websites are more effective in achieving the outcome of weight loss through dietary modification than a static informative website. In this study, there was an interactive website for the study group, while the control group had access to similar information on dietary changes focused on reduced caloric intake, but without the interactive component. The study group had significantly more weight loss, both at the end of 3 months and also 12 months later. In another randomized controlled trial on smoking cessation, the investigators compared the website webquit.org with another site, smokefree.gov. Webquit.org had interactive components and used ACT, or acceptance and commitment therapy, approaches for behavior change, which focuses on values, committed action, willingness, and being present. Smokefree.gov was purely informative. The quit rate for the users of the interactive site was higher than the purely informational site. This study provides preliminary evidence that digital interventions may be efficacious for helping patients quit smoking.
What are your overall conclusions about website-based interventions?
Although some of these smaller studies show promise, I don't know of definitive evidence of website-based interventions resulting in improvement in cardiovascular outcomes. In general, the more engaging these technological interventions are, the better the outcomes. Perhaps targeted outreach and using technology to connect with human support, such as health coaches, may be the most valuable.
So we've talked about text messages, email, and website-based technologies. How do we know which patients will benefit from this technology, whether it's email or text messaging? Are there studies that suggest which patients are more likely to use and benefit from technologies for health promotion?
There was a review article about a year ago trying to answer this question specifically as it relates to the ability of people over the age of 50 to utilize digital health technologies. Based on this review, evidence suggests that older people can't effectively use digital technologies. The biggest promoter of their use was more related to the access to human support as opposed to the type of technology, such as a website or an app. Most of the studies also tended to address the outcome of mobility over other health targets in this age group. As an aside, a resource I often suggest to my patients over 65 is the Silver Sneakers website, which has access to videos of online exercise classes that the patients can do at home with minimal equipment.
That's right. And for many older adults with Medicare Advantage, this would be at no cost to them. And they have a smartphone app for videos, recipes, and more.
Yes, it's a great resource. Though another takeaway from that review article was that a lot of the studies tended to select a more affluent population with a higher educational level. More studies are needed to understand access and usability of technology for patients with lower incomes and those with lower overall health literacy.
What about artificial intelligence? I've noted recently that whenever I ask a question of Google, there is often an AI response listed.
This is definitely a next step in online health information. With the relatively new nature of ChatGPT and other AI sources, there will need to be more studies on the quality of available information, as well as the potential risks of AI generated content for health promotion. AI has been deployed with such speed that more patients will be using these tools in the near future, if they aren't already. It is probably more reliable at this time for patients to use AI sources to get more information on things like medications or diseases, as opposed to using it to assess symptoms or to make a diagnosis. However, not all sources are equal, and if questions arise, your provider is a great source of information as well.
How can patients and providers assess the quality of various websites? For example, good quality websites like Cardio, is there a standard?
Some items to look at for assessing health information quality are the source and the accuracy. Who's sponsoring the page? In assessing accuracy, is the information based upon peer reviewed evidence? And have the references and citations been included? Is it up to date? This is where copyright date or date reviewed can be helpful. Also, look at transparency about who wrote the information and their qualifications. Who is the intended audience? Consumers versus healthcare providers. Does the information seem biased? Any claim that seems too good to be true probably is.
Let's turn our attention to mobile apps. It seems like AI gets all the attention recently, yet mobile apps are everywhere. How can they help us help our patients?
Health apps allow patients to log data to support management of chronic conditions. They can help with tobacco cessation and weight management. Mobile apps can have a positive impact on health by providing non face to face support to improve adherence by allowing self monitoring, which is significantly associated with improved outcomes in chronic disease self management. Apps enable patients to enter their data to track health parameters such as weight, blood pressure, and blood sugars, and to monitor their progress for control.
Can you give us some examples of commonly used mobile apps for health?
MyFitnessPal is a popular app with a free basic version that can track nutrition, exercise, and weight to help people reach their lifestyle goals. For example, it can track calories, macro and micronutrients, and water intake, providing a daily nutritional profile to support healthier food choices. It also tracks calories burned and weight to help reach overall health goals. The iPhone Health app is another popular app that allows tracking of similar information, including activity, mood, and medication adherence. The activity section tracks active calories, minutes of brisk activity, how often you stand, and shows steps and flights of stairs climbed daily. When paired with the Apple Watch, additional information is available, including heart rate and sleeping profile. It can also show resting heart rate and break down activity to show walking speed and balance, which can be helpful for people as they age and mobility declines. Patients can review this information with their providers to explore more opportunities to improve their health.
How effective are apps for improving healthy behaviors?
As you might imagine, there's a great deal of variability in the features and components between mobile apps. Apps can do many different things. There's some evidence that apps can be helpful in chronic disease self management, but findings are mixed. There was a 2022 meta analysis which reviewed 15 randomized controlled trials ranging from 1 to 12 months with 7,415 adults with hypertension. The intervention included using the mobile app to self monitor hypertension related health behaviors, such as smoking cessation, nutrition, exercise, and medication adherence, compared to usual or minimal care. This showed a small but significant improvement in systolic blood pressure of 1.64 millimeters of mercury, where the intervention group was also 60% more likely to have a systolic blood pressure less than 140 and a diastolic less than 90, and over 3 times more likely to be adherent to medications. There was a 2024 Cochrane review of 18 randomized controlled trials composed of 2,703 adolescents and adults with overweight and obesity that evaluated the impact of a mobile app on weight management. The main intervention included education, goal setting, social support, feedback, and self-monitoring that were integrated into a single mobile application such as Lose It, Weight Watchers, or apps developed specifically for the study, with a minimum follow-up duration of 3 months. The study found insufficient evidence to show a clinically significant benefit and noted that many popular mobile apps, including MyFitnessPal, Noom, and Fitbit, didn't meet the eligibility criteria to be included in this review. So further studies of more commonly used apps would be helpful.
I've read about how some health apps are incorporating games to engage patients. They call it gamification. What can you tell us about this?
Gamification takes a regular task or activity and creates a game with a competition, points, or badges to promote participation and engagement. A 2023 scoping review of 70 studies from 2012 to 2022 of adults with chronic diseases, including cardiovascular or metabolic disease, to determine if gamification could improve self-management. Self-management includes medication adherence, physical activity, and symptom management. The review found that adding gamification could help patients achieve exercise goals through games that promote activity, such as Pokemon Go and Nintendo Wii, and medication adherence through improved condition knowledge and motivation. While further research is needed, this could be another tool to help support people in their chronic disease management.
There are so many apps out there. How do you know which one to choose, or how do you compare the apps?
This is a big issue in the study of mobile health apps. A standardized methodology should be used by researchers to ensure the evaluation of apps is both comprehensive and high quality. One method outlines 7 steps to aid in the review of mobile health applications, which includes a scale to evaluate quality and functionality. To date, most of the published studies on mobile apps have not used this type of systematic methodology. The FDA regulates medical devices that pose a risk to patient safety, but considers health applications to be low risk. Therefore, they are not currently regulated. This includes nutrition and fitness applications such as MyFitnessPal and Fitbit.
Let's turn our attention to another tech tool which you've mentioned, wearables. These would include smartwatches, fitness trackers, and smart rings.
Yeah, these devices such as Apple Watch, Fitbit, Garmin, or the Oura Ring are largely being sold directly to the consumer and can track metrics such as heart rate at rest and with activity, heart rate variability, oxygen saturation, blood pressure, as well as advanced metrics like VO2 max and cardiac rhythm. Additional features include step count, minutes of daily physical activity, sleep tracking, and fall detection. Note that these consumer devices are not reviewed or regulated by the FDA.
Are any of the wearables effective for promoting cardiovascular health?
One way that wearables can be helpful is by diagnosing cardiovascular conditions. There were 2 recent articles from 2022 which indicated that wearable devices can be used as digital diagnostic tools. The technology utilizes heart rate algorithms to diagnose cardiovascular disease, such as atrial fibrillation. A challenge highlighted in the article was that the data collected in a time series was somewhat difficult to analyze due to the large volume of data generated. The Cochrane Group has a proposal pending to conduct a review of wearable devices, but to date, it has still not been completed.
These devices seem to hold a lot of promise, but there still isn't a lot of evidence.
Research supporting use of wearables in medicine is still in its infancy, but clinical applications for these devices include the diagnosis of acute disease, the telemonitoring of chronic disease, exercise prescription, promotion of physical activity, and exercise performance and improvement. A major barrier to universal use of such devices will be the difficulty obtaining them for patients who can't afford them, as most insurance companies will not yet reimburse for wearables.
What concerns have been raised about wearables?
Concerns have been raised regarding the accuracy and reliability of these devices. A systematic review conducted in 2020 found that heart rate measurement was found to be somewhat variable. The Apple Watch and Garmin devices were judged to be the most accurate, and notably, all devices were accurately measuring step count.
So, what is your conclusion about the effectiveness of these devices?
While there is no definitive evidence in the literature at this time to recommend for or against the use of these devices, clinical judgment supports the use of these devices as an objective means to quantify patients' physical activity over time. Additional concerns with consumer wearable devices include issues around privacy and data sharing, lack of integration into the electronic health record, and time for clinicians to interpret all of this data patients bring in, for which there isn't yet any reimbursement.
Let's discuss social media as an intervention to promote improved cardiovascular health. Some patients and even their doctors may not use social media and do not understand how it could promote health.
Right. Social media refers to web-based applications and websites that provide platforms for users to connect and share content and information. These virtual environments help users create online networks and communities where they can interact with others. Common applications of social media include Facebook, Instagram, TikTok, X, which was formerly known as Twitter, Reddit, LinkedIn, Snapchat, and YouTube.
Is there evidence that social media can be effective for promoting improved health behaviors for the prevention and management of cardiometabolic conditions?
One Cochrane review of 88 studies, 84 of which were randomized controlled trials, composed of 871,000 adults, evaluated whether social media helps to change health behaviors. The interactive social media intervention included activities shared in online communities where people exchanged information and knowledge in two-way communication, and where users or members have the ability to communicate directly with one another. The review found the intervention may improve physical activity across 54 randomized controlled trials with 20,000 participants and showed small improvements in both resting heart rate and weight loss.
Aside from the Cochrane review, has there been any other research?
There was another review of 16 randomized controlled trials, which evaluated the impact of social media on weight and physical activity, where the intervention duration ranged from 2 to 24 months and included social support groups to share information, set goals, and encourage self-monitoring of activities. Results showed that there could be a positive improvements through interactive social media interventions on both activity and weight, but it was difficult to attribute solely to one social media intervention, as often there are multiple contributing factors. Further studies are needed to evaluate the effectiveness of social media interventions on health behaviors and to determine if social media can positively impact or influence health behaviors and outcomes. But these online communities could be helpful as a place for people to find support and share information.
We hear a lot about the negative effects of social media. What can you tell us about the drawbacks of social media use?
A negative impact of social media is worsening mental health, feelings of depression and anxiety, particularly in teens and young adults, which often outweigh the benefits of social connection. Misinformation comes up as a concern quite often. The same strategies we've discussed for assessing evidence basis, quality, and transparency are also true for social media information.
We've covered a lot of ground today in our discussion and use of digital tools to improve health behaviors in the pursuit of better outcomes for patients with cardiometabolic conditions. We've discussed text messaging and email interventions, website interventions, AI, mobile apps, wearable devices, and social media. Do you think these technologies are the future for adopting and sustaining healthy lifestyle behaviors?
That's a good question. Developers and investigators are actively creating and testing digital tools intended to support adherence to the types of healthy behaviors that we recommend to patients. Some of these technologies are more mature than others. Email and text messaging have been around for a long time. And as we discussed, text messaging can be effective for diabetes self-management, weight loss, physical activity, and smoking cessation. I believe that texting will continue to be heavily used in health promotion, not only as a standalone intervention, but in conjunction with other tech like mobile apps, social media, website based interventions, and even wearable devices. We are seeing more multifaceted digital interventions such as smartphone and web based interventions that include text reminders, alerts, and tools for tracking medication taking, exercise, sleep hygiene, and other behaviors.
Should providers recommend these tools to patients?
Some patients will be receptive, while others will have little interest. Those few who are very keenly interested in technology probably know more about these digital tools than we do. But for most patients, if the patient seems to be at least minimally digitally facile, perhaps as evidenced by having a smartphone or a fitness watch, it may be helpful to open a discussion by asking if they use or have considered using any digital tools to make it easier for them to take their medications, monitor their blood sugar or blood pressure, exercise, or get adequate sleep or lose weight. This is likely to be the most effective if it is part of a discussion with the patient about a particular health problem or health behavior. In my experience, a patient's interest in a particular digital tool is an important factor as to whether or not they will try it. That is often shaped by the patient's prior experiences. Some people use their smartphone for many things beside the obvious uses, whereas others have little inclination to do that. Similarly, some wear Fitbits or Apple Watches to track their resting heart rate, sleep quality, minutes of physical activity, and even their stress levels, whereas others may want to use them only as step counters. It may be that the tide will eventually sweep most of society along, resulting in widespread adoption of digital health technologies over time. But for now, it's highly variable. We can view these tools as additional modalities that may help our patients adopt healthier behaviors. We can support and encourage them to use the technologies that help them achieve their health goals, knowing that patients usually view digital technologies from a very pragmatic perspective. If it works for me, great. But if it doesn't help me or it's too inconvenient, I simply won't use it.
So, what do you see as the future of technology in reducing cardiovascular risk?
In my opinion, technology interventions are an additional tool with potential benefit and very little risk. Risk is minimized by helping to direct patients to sources with up-to-date and credible information, such as the Cardi-OH website and some of the newer ones we already mentioned. These resources will also continue to evolve with newer technologies and the integration of artificial intelligence. We should also recognize that more data is needed, specifically with randomized controlled studies, to more fully assess the end results of these resources. Future areas of study should also include looking at these methods in a more underserved population, as this hasn't been looked at closely. One takeaway is that technological interventions will continue to require human support for optimal benefit, and that's where we come in as providers.
So, digital technologies can be helpful adjuncts to our work as providers.
Yes, I don't see our work as providers changing in this regard. We will still need to use evidence-based approaches like motivational interviewing and setting SMART goals. We have great resources on the Cardi-OH website that we will link to in the show notes regarding these approaches. As patients move towards making changes, they may be receptive to technologies that can help them, and we can support them in this.
Thank you again for your time, Dr. Ryan.
Thank you so much for having me. I enjoyed the discussion.
And a special thank you to our listeners for tuning into Cardio Radio.
This concludes today's podcast. Be sure to visit cardio.org to learn more about the Ohio Cardiovascular and Diabetes Health Collaborative.